Down syndrome is one of the most common chromosomal disorders around the world. It occurs in about 1 in 1,000 live births worldwide. But what exactly is Down syndrome? Well, Down syndrome is a chromosomal disorder which results from a genetic mutation. Chromosomes are thin thread-like structures found in body cell nuclei which contain genetic material in the form of genes. A typical person has 46 chromosomes while someone with Down syndrome is born with 47 chromosomes. The extra chromosome is an extra full or partial copy of chromosome 21. The occurrence of an extra separate chromosome is referred to as trisomy. The genetic material in this extra chromosome copy is associated with developmental delays and distinct physical features in children with Down syndrome. Apart from trisomy 21, the most common type of Down syndrome, there are other more rare types of Down syndrome. Translocation Down syndrome occurs when the extra or partial copy of chromosome 21 is attached to another numbered chromosome. It is not separate as in trisomy 21. Mosaic Down syndrome occurs when some body cells contain 47 chromosomes, but other body cells contain the typical 46 without the extra copy of chromosome 21. Both translocation Down syndrome and mosaic Down syndrome combined account for less than 5% of all Down syndrome cases. Some distinct outward features you may have noticed include almond-shaped eyes slanted upwards, a flattened nose bridge, small ears, hands and feet, a short neck, poor muscle tone and a single palmar crease. Now that we've discussed what is Down syndrome, you may be wondering what are the risk factors for having it. Well, Down syndrome is the result of a random occurrence during cell division. It cannot be prevented. However, the risk of such divisions do increase with a mother's age. Those over 35 have a higher likelihood of their pregnancy being affected by Down syndrome. Now let's talk about how Down syndrome is diagnosed. Usually, prenatal screening tests via blood tests or ultrasound can be used to infer whether a fetus will be born with Down syndrome. Diagnostic tests during pregnancy are then used to confirm this. Checking for physical signs after birth, and blood tests of the baby are also used in diagnosis. Children born with Down syndrome are at greater risk of having associated medical problems. These include congenital heart defects, hearing and vision problems, gastrointestinal problems and sleep apnea. Down syndrome is a lifelong condition with no cure. However, with adequate care and a supportive environment, persons with Down syndrome can go on to live long, fulfilling lives. Treatment usually includes speech therapy, occupational or physical therapy, specialist care for underlying conditions and any special education needs. Now that you know all about Down syndrome, how can you spread awareness about it? Well, World Down Syndrome Day is celebrated every year on March 21st. To celebrate the rights of those with Down syndrome as any other persons, encouraging fairness and equal opportunities to improve lives. Every year, you can show your support in stimulating Down syndrome awareness by joining the Lots of Socks campaign, wearing long, colorful or mismatched socks on March 21st. You can also join or create fundraisers for your local community. Even encouraging conversations with your friends about being inclusive and appreciative of everyone's talents and abilities can truly make a difference. To learn more about Down syndrome, you can visit the Global Down Syndrome Foundation or the Down Syndrome Resource Foundation websites. I hope you found this video useful. If you like this video, subscribe for more. I'll see you next time. Till then, keep learning stuff.